CyberKnife is a very specialized way of delivering stereotactic radiosurgery. With standard radiation treatment, you use fairly large beams of radiation because tumors move during treatment and you have to have a margin of normal tissue around the tumor to accommodate for that motion. So that means that you're treating a little more of the normal tissue than you would really prefer to. And as a result of that, you have to give a little bit of radiation every day. Tumor tissue can't repair radiation damage very efficiently, but normal tissue can. So if you give a little bit of radiation every day, you allow the normal tissue to repair damage before the next day's dose, but you're accumulating damage on the tumor. So the net effect at the end of treatment, you hope, is that you're going to kill the tumor and the normal tissue is going to be spared. But that kind of treatment can take a long time. Sometimes, for instance, with a woman with breast cancer, it could be 6 weeks. For a man with prostate cancer, it could be more than 8 weeks. CyberKnife is unique. With the CyberKnife, with small tumors in certain locations, for instance, small tumors in the lung or small tumors in the brain, you can focus multiple tiny beams of radiation on the tumor coming in from many different directions, sometimes 90, 100 or more beams. So all the tumors coming in from a different direction means that none of the normal tissue around the tumor is going to be seeing much radiation at all. Plus, the CyberKnife can actually track the tumor. It can see the tumor, so the beam of radiation actually moves as the tumor moves. So you don't have to have a margin to accommodate for tumor motion. So instead of giving a large number of small doses, you can give a small number of very large doses that radiobiologically are equivalent to much more dose than you can give in a standard fashion, and essentially can ablate the tumor just as if you had gone in and removed it surgically. For instance, the results with early stage lung cancers are now rivaling the results that you can get if you open the chest and take the tumor out. CyberKnife is just a very different way. It's not applicable to everything we treat. The vast majority of things are still done in a standard fashion using machines called linear accelerators, but the CyberKnife gives us the ability to do very specialized things that we couldn't otherwise do. It's very gratifying to be able to offer people things that you couldn't have done before. And it's such a, and I'm such kind of a technology freak, it's such cool technology. Using the machine is just really a whole lot of fun, and some of our patients have done extremely well. I mean, you see these people with lung cancers who have terrible emphysema, COPD, or heart disease, who in no way could be a surgical candidate, and you can treat them with CyberKnife. They'll have 2, 3, 4 fractions of treatment over a week's period, and they're cured with practically no side effects. It has been a wonderful thing for our department and for our community to be able to offer this.